From the Black Death which ravaged Asia and Europe in the medieval period and the Spanish flu pandemic to modern-day health challenges, the global community has continued to face emerging concerns requiring intervention of medical personnel with doctors in the lead. This is why lots of emphasis is being placed on producing doctors which are in tune with present-day realities affecting the health sector. In the studio to discuss efforts being made to raise the bar of health service delivery in Nigeria to arrest these emerging trends and effective response to these issues is the Registrar, Medical and Dental Council of Nigeria, Dr. Fatima Kyari. Thank you for joining the Network News on NTA, Doctor.
Thank you very much, Najatu. It's a pleasure to be here.
Let's dive in, Doctor. You're focused on health sector manpower capacity development. How do you carry on with this mission and in practical terms so that Nigerians will have confidence in the national health service industry?
Well, I'd like to say that we do recognize that the more doctors we produce, the more that leave our country, and what we term brain drain. But we also want to ensure that we have brain gain, not just brain drain. And then we also want to avoid brain waste, which is doctors leaving the shores of our country, but they don't go to other countries to practice as doctors. And that is brain waste. So what are we really doing to ensure that we want people, our doctors, to stay, the doctors that remain in our country? How do we make them remain in our country? So one of the strategies we're looking at is education and engagement of the doctors that we train. For example, when we train doctors, we want to include them in our vision at the Medical and Dental Council of Nigeria. The Medical and Dental Council of Nigeria is the regulatory body for medical and dental professionals, and we register them. We keep a register of those professionals, and we always ensure that we have a say in who we put on the register. So once they're on our register, we ensure that they have good practice, good medical practice, and if there's an error or if they err, we bring them to professional discipline. So as I was saying, we want to educate, keep them in the education and engagement, keep them in the process, keep them within our vision. So our vision is actually to empower medical and dental practitioners towards patient safety. And then we also want to ensure that they have leadership capabilities and career progression in terms of retention capacity in residency training programs, career progression, research opportunities. And of course, we also want to include them in physician well-being strategies. So we want our doctors to feel confident, our doctors to be safe, and also encourage patient safety, which will now be, on the flip side, the trust from the public and them wanting to, engage with our doctors.
Let me come in here, Doctor. So essentially, once a doctor or a dentist is council certified, a patient can be sure that he or she is getting the best care. Now, if that's the case, what major challenges in the health sector across the globe, one of the challenges rather is the emergence of new threats such as pandemics or economic emergencies. How will the council prepare the Nigerian health sector to be more resilient and agile as threats come up?
So one of the ways we need to look at, global threats are actually multisectoral. We need a multisectoral strategy to address them. But from MDCN, what we're looking at is encouraging or enhancing the curriculum so that there will be, we recognize epidemiological studies, emergency medicine, so that our doctors are able to handle the pandemics, any threat that comes. And we at the Medical and Dental Council of Nigeria have also acknowledged that there's a national epidemiology or field epidemiology training by the NCDC, and that is also recognized at MDCN as an additional qualification. So we have a register of that. And these are people that we can call upon. But as I said, you know, it is a multi-sectoral strategy that addresses threats like this. At MDCN, what we can do is actually to encourage the training for threats, and then keep a register for those who are trained, and then include maybe, you know, during our accreditation process that hospitals and training institutions abide by these. But by and large, we'll collaborate with the institutions that actually, you know, are at the forefront of such threats.
Thank you very much, Doctor. I've been talking with Dr. Fatima Kyari, who is the Registrar and CEO, Medical and Dental Council of Nigeria. Thank you for giving us insight into this area.
Thank you. You're welcome. Thank you very much.